Hello and welcome to Newswire. I'm Jawad Tehami. As the number of the corona fatalities and infections around the world increase, the governments are taking stricter measures to check and contain the spread of the disease. As of today, the number of fatalities has risen to 38,100 and the infections have risen to 789,787. When China was battling the outbreak by enforcing stricter quarantine measures, many world leaders criticized it for its actions against human values. But as more and more countries have come into the grip of this deadly virus, governments all across the world are adopting similar sort of measure. These include lockdowns, quarantines, and forceful requests to the people for observing personal and social distancing. Italy and Spain are the worst hit in Europe, while Iran in the Middle East presents a gloomy picture. And in the Americas, the US has become the new epicenter of the pandemic. US President Donald Trump has extended federal guidelines on social distancing until April the 30th. To talk more about what the governments are doing, is it enough to successfully contain the spread of the virus and reduce the human loss? We are joined today at Newswire by Dr. Valerio Alfonso, political analyst and senior fellow at the Center for Analysis of the Radical Right, fellow at the Center for the Future of Europe, joining us from Napoli, Italy, and Mr. Hamid Reza Gholamzadeh, analyst, joining us from Tehran, and Mr. Henry Bolton, politician, joining us from London. He has been formerly the leader of the UK Independence Party as well. Thank you all of you gentlemen taking out time for Indus News today, particularly at the Newswire. Starting the discussion with you, Mr. Bolton. US President has finally extended the federal guidelines until April the 30th. On the other side, we saw that New York governor had been pleading and asking for relief, and he has been pointing fingers continuously towards US President for his laxity in response to this outbreak. What do you have to say about it?
I think one of the major problems that the United States is facing in this crisis is a mixture of messages. And it contrasts quite sharply with the situation here in the UK. For example, Boris Johnson has made it very clear right from the beginning that he is acting and making decisions based upon the advice of his chief medical advisors. Whereas in the United States, it's quite clear that Donald Trump, at the beginning of this crisis, as it was affecting the United States, was more interested in protecting the economy rather than taking the pandemic as a serious threat. That obviously has evolved. And as that's evolved, the people on the ground, the governors have been demanding more action from the federal level and are now starting to get it. I think this mixed messaging and lack of decisiveness from the White House has actually undermined the United States' ability to control this from the beginning. I think it's a great shame.
Okay, this very particular point that late response and from the White House in dealing with this problem, this catastrophic situation over there, well, actually led the US to become the new epicenter of the outbreak, with having the highest number of infections as we speak now. Dr. Bruno, do you think the government's late response was actually responsible for such a catastrophic situation that we are currently seeing in the United States?
Yes, I think in the case of the United States, there is a huge responsibility because there was the example of Italy right there. It was already a few weeks that in Italy we were telling everybody this virus is strong, this virus can spread very easily, so you should take a countermeasure as soon as you can. But yet, in many countries, including the US, the messages from Italy were not taken too seriously, like exaggeration, and unfortunately, so far we are witnessing a very, very fast rising of the cases in the US. It's the new epicenter of the pandemics. And yes, I think there was a big mistake not to listen to what was happened to Italy.
Dr. Bruno, as we have seen that Italy had been hard hit by this pandemic in Europe, and the number of infections in Italy as we speak have gone more than 100,000, 1,739. And total deaths over there are 11,591. Do you think the US administration at this point in time is repeating those similar sort of mistakes that were actually done in case of Italy?
Yes, for sure, because also, for example, what they've been doing with the New York, not implementing a strong lockdown in the states and of New York, in the city, with the city of New York, because of economic reasons, of course, will have a strong impact in the future. There are more than 50,000 coronavirus cases in New York. The majority of the deaths from the US are in New York. So the same mistakes that we had in Italy, we didn't implement a stronger lockdown at the very beginning because of fear of economic impacts. And so we see in Italy the virus is having a huge impact. And let me tell you that there is an underestimation of the cases in Italy. Most probably we don't have 100,000 cases, but we can speak about 1 million to up to 6 million. And the same concerns the death toll. Probably we don't have 11,000 people that have been dying in Italy, but much more. So I think really the US made a huge mistakes not to listen to what the message from Italy was in time.
Dr. Bruno, I'll come back to you with this, what the situation exactly happens to be in Italy for right now. There are a couple of studies which are being reported at the moment. Who are the basic victims or the affectees of this particular deadly virus? I'll go to Mr. Gholamzadeh. The US top medical official has warned between 100,000 to 200,000 fatalities. He has said that this number could be up to this one. Isn't it a huge number? Isn't it a startling warning by the US medical official? How do you see, I mean, would the US be able to contain the virus, and this number which has been warned by Dr. Anthony Fauci, it could reduce the damage of the human loss over there by now taking some strict measures?
It was actually the warning that we have been saying that if the virus is not contained in the United States, it would turn into a human catastrophe, and it would damage horribly the country. Because the flu, in the flu season, the flu had taken about 60,000 victims in the United States. So when we come to the coronavirus, which is something new, something without a cure, so that would be expected to be much worse than the influenza. So that has happened, and the main reason is that the Trump administration tried to politicize a health issue. At first, they called it a hoax, and then they said that it is something under control, we are doing the best and such things, and they were not actually paying attention to the facts on the ground. They were not, as Dr. Bruno said, they were not attending to, they were not actually concerning what has happened in the Europe, especially in Italy. Or they were trying to politicize it against countries like Iran or against China, calling a virus a Chinese virus, something, let's say, racist call for that. All of these things are the problems that the Americans are facing there. They are, as I said, they're politicizing a health issue which is actually targeting the people regardless of their race, regardless of their ethnicity, regardless of their nationality, regardless of their religion, whatsoever. We are all human beings, and we are all possibly hit by the virus, and that would result in casualties. The other problem is that the health infrastructure in the United States is totally destroyed, and it's very terribly, actually, in a bad condition. As we have had here, for example, in the debates among the Democratic candidates in the presidential run, they have actually criticized the structure, the infrastructures, and the healthcare, and all the things that we have had in the United States. Even for example, the diabetes, the insulin. was at 10 times more expensive than Canada, for example. So in this situation, 100 to 200,000 victims would be a very good actually outcome for the Americans, because the situation is terribly awful. And if they can reach that point, unfortunately, it's too high. I understand that, but regarding the situation,
but you're of the view that if they are able to
outcome.
contain from this point onwards, this number which has been warned by Dr. Fauci would be a good number to be dealt with by the American authorities. But talking about Iran, we have seen Iran is the worst hit country in the Middle East. For now, there are more than 41,000 infections with over 2,500, like, for example, 2,757 to be exact at the time, the number of fatalities over there due to the virus. Why Iran came into the grip? What were those basic elements that added to the catastrophic situation within Iran?
The first problem for Iran was that because of the sanctions that are imposed by the United States, unilateral sanctions which are against the international law, Iran has not been able to benefit from the global cooperation, receiving test kits and such things at the beginning. So it was very actually difficult for Iran to handle the situation at the beginning. However, it has changed a little now. We are almost in a stable situation now. And Iran has been successful actually in having the highest number of recovered patients. We have about 1/3 of the sick people have recovered, and it's based on the list that we have from the other countries. Iran seems to be the best performance in that regard. But there is still the problem with the sanctions that do not allow other countries.
Mr. Gholamzadeh, here you mentioned a pertinent point. Very quickly, before I go to Mr. Bolton, I would like to understand what exactly those measures were. As you said, that Iran, in a way, happened to be successful because there is a recovery rate of 1/3 of the patients have recovered. And the current statistics that I have got is 13,911 for now have recovered in Iran. So what were those exact measures the Iranian authorities put in place in order to contain it?
It's actually, first of all, it's the infrastructure of the healthcare, hospitals and such things, and the cooperation that all the bodies from the health ministry to government to army, everyone is actually doing there. And we have, like some other countries, we have very, very dedicated medical staff who are working very hard to do their best. And we have also some volunteers helping the medical staff, because anywhere in the country, in the world, the medical staff are not enough to handle the situation. So public help is needed. And we have had many volunteers from day one that they were trying to help the situation. Of course, we still have some problems with some people ignoring the measures that the government is putting to control it. For example, social distancing, physical distancing, and such things. We still have problem with that part of the public. But anyway, in terms of the healthcare, in terms of for example, the costs of which is actually free for the people to go through the test and to receive the medical treatment. And all the services that they are giving the people are something, as the performance shows, something acceptable and successful, as WHO has actually, in several cases, confirmed and admired the performance of Iran in that regard.
Okay, Mr. Bolton, as Mr. has just alluded to, that there is a volunteer force also, which is also taking care of this particular dealing with this pandemic in Iran, and that happened to be a very important element in combating this crisis situation. When we talk about New York governor, he has said that we need volunteers because New York City alone happens to have over 1,200 fatalities due to the coronavirus. He says we need to have volunteers. Having volunteer force to combat this crisis, don't you think, because it is a contagious disease, doesn't it make those volunteers also vulnerable to the disease so that they could also catch the disease? Because we have seen in the case of medical practitioners who were dealing with the patients of this coronavirus, many of them in Italy, even in China, succumbing to the disease.
Yeah, absolutely agree with you. And one of the problems that every country is struggling with is reliable testing as well, so that people, volunteers included, but also professional healthcare workers, so that we can understand whether or not they've been infected and whether they have the antibodies and therefore some sort of immunity, because otherwise we could be putting people in danger. But the other thing about volunteers is that you have to know what you want them to do, what jobs you're going to give them, and why you're asking for volunteers. Here in the UK, we've had over 700,000 volunteers, plus we've had 20,000 retired doctors and nurses coming back into their health service, plus we've got 20,000 military, both logisticians, engineers, and also medical staff. So we've brought all of these people into the situation, but it is pointless doing that. In fact, it creates a problem if you don't understand what you want them to do. And I'm afraid, from what I understand is going on in New York, the governor wants more people. He's asking for more resources, for volunteers. But does the governor, and I don't think he has, does the governor have the logistical and planning capability to be able to identify exactly what these people are supposed to do if they volunteer and how to manage them in the correct way? That's a massive problem. If he's not careful, he'll get volunteers who, A, are vulnerable to the disease, and B, who require him to divert resources from somewhere else to manage them. Well, we have to be very careful about this, and this is one of the problems with the United States. As was said, the healthcare system over there is not set up for this, but also the fragmented way that government works. So at the state level, at the city level, and so on, they all have their different authorities. They do things in different ways. So it's actually quite difficult for the federal level to coordinate this in an effective way. Plus, if you have Democrat mayors with a Republican sort of president, then of course that causes additional problems as well, particularly when you have a president who doesn't particularly want to talk to Democrats.
Okay,
so I think,
Mr. Bolton, that's why particularly the problem that you've just said, that New York governor would have to ensure it that the volunteer force he's trying to have is what exactly is the job that he's going to take from them. That's why perhaps he has called in the Navy to help the authorities in order to combat the crisis this time around.
He has, and I think one of the advantages that we had early on was that the government brought in, we have people who, in fact I'm one, who are trained military, what we call joint operations planners. And the British system is such that in a crisis like this, one of the first things that government does is bring in these people to help government departments and ministries to plan and to ensure that there's cohesion and proper coordination across the whole activity. Now that's what, and the military are good logistical planners, and logistics is what's going to win this, not just medical science. And in New York, they've done this. They've brought in U.S. Navy medical people as well. So I think that is going to be a help. But what we've already said, and it is a problem for the United States, is that they have left it very, very late because the president wanted to calm fears on the markets rather than tackling with the reality of this pandemic. He was out of touch with what was happening in the rest of the world and for some reason thought the United States would be relatively immune. He has been proven wrong, and the United States is going to suffer. And an interesting question looking forward is how is that going to affect the prepresidential election?
Mr. Bolton, sorry for the interruption, but coming to the UK, as you have just mentioned, that authorities over there are taking prompt measures. When we talk about the National Health Services, they said if we keep the death toll in the UK below 20,000, that would be a sort of a success for the authorities. How do you see this thing?
So it's already been said from the Italian case. We don't know the precise figures. So at the moment, the death toll in the UK, as of yesterday, was 1,408. But we can probably add another 500 to that because there are people who have died outside hospital, and that's a different reporting process. But the answer is yes, and we're seeing a slight flattening off now, hopefully, of figures over the last 2 or 3 days. But it's too early to tell. The analysis is not complete, and so I think and there was a slight delay here in the UK, and that was due to Chinese reporting and so on, or lack of, or not misleading reporting in the early days. But I think that the crucial thing now is that every government needs to take this seriously, and it needs to have what I would call unity of effort. If different levels of government or different parts of a country or different agencies within the country are not all working together as one team under clear directive leadership, then their people are going to suffer.
So Mr. Bolton, you are of the view that the governments have to work in union, and that there should be a unity of effort in order to win over this pandemic. Mr. Henry Bolton, politician and also formerly the leader of the UK Independence Party, thank you very much for your time being at the Newswire today. I'll go to Dr. Bruno. When we talk about WHO, it has said that Italy and Spain, these are the two worst hit countries in Europe, but there happens to be a stabilization over the recent couple of days because the number of cases are not being reported in that huge number as it was happening before 2 or 3 days.
Yeah, apparently, at least in Italy, there is a decrease of the new cases of coronavirus, even though it has to be said that we are implementing not enough tests to detect the virus. So, yeah, most probably that there must be a decrease, but we are not sure of it. The real problem is that, as was said before, for the US, we have first line, we are kind of doctors, nurses, our first line infantry, let's say this image that we send to the hospitals to take care of people having the coronavirus. And we don't have the equipment, the protective equipment, the medical equipment to fight this war. So it's a little bit in Italy like we are fighting a war, but we have really not the tools or the equipment to fight it properly. And it is a pity for a country like Italy, and we were supposed to be ready for the pandemics since years, as the WHO was warning about the possibility of a pandemics in the world since 20 years from now. But we were not ready. So, as I said, again, we're fighting a war
so
right now.
Dr. Bruno, as you said, that Italy should have been ready for the pandemics in order to deal with such a situation. There are certain reports that suggest that the age group that has been the victim of this deadly virus were from the old age in a majority. Is that study a correct one?
Probably the people who are suffering more and dying more are, of course, older than 70. So there are a lot of people who are in the 80s, in their 90s, who are dying from the coronavirus. But still, there are a lot of people who are spreading the virus in their 20s, their 30s. They don't know because there are no tests, no kit to have the result to be positive of the coronavirus in Italy. There was a huge controversy because in Italy, few football players, actually more than few football players, they were able to have a result, positive or negative, to flee Italy, to go back to their countries in South America. But our medical doctors, our nurses, they are not able to have the result. They are not able to have a kit to get to know if they are positive or not to coronavirus. And yet they have to work in the hospital with the possibility to spread the virus to everybody. And so this was a huge controversy, and it's a shame in Italy we are fighting this war. Allow me to use this image. It's a harsh one without the equipment. A country like Italy in the European Union, we should not be fighting a war like that without the necessary equipment and sending our doctors, sending our nurses, and all the people working in the health sector to the war first line.
So, Dr. Bruno, you're of the view that actually the world needs to come to help Italy at this time of crisis, and there should be sending the medical teams as well as the medical equipment in Italy so that Italy can fight with this particular crisis. Mr. Gholamzadeh, when we talk about certain other countries, there are certain specific countries in the world which are responding to this pandemic in a very different way. Talking about Brazil, the Brazilian president has said that it is an ordinary flu and people would die of hunger more than that of the coronavirus. And on the other side, we see within Europe, the Netherlands is going for herd immunity. So how do you see both of these responses? Are these responses a sort of a denial to this pandemic, or are they founded on the ground realities?
Unfortunately, some countries are trying to say that they are different from the rest of the world. We are all human beings. You cannot react to a pandemic in a different way, ignoring the experience of the other countries and ignoring the scientific studies on the ground. We don't have enough scientific information about that. That's a fact. But meanwhile, you need to rely on the experience of the other countries. We have Italy as a very important experience ahead of us. We have China handling the situation already. We have the United States ignoring and now suffering a very high number of casualties and patients. So by saying that, okay, there are many other people killed by other means, yeah, that's correct. Many people are dying of cancer, many people are dying in shootings, many people are dying of in car accidents and such things. But it doesn't mean that you can let the people die of another reason as well. Especially when it is a pandemic, it is a very easily going virus that can kill vulnerable people. So it's what the Brazilian president says is totally wrong. And the Netherlands, the Dutch government, is experiencing something that, as far as I know, the British government was doing at the very beginning, and then they understood that they were wrong. It was actually something that the Iranian president was mentioning in a few weeks ago, and however he very soon put it aside that this method is not going to be good enough because it would expand the curve up to the next flu season. And it can have extra burden on the
Mr. Gholamzadeh, this is the thing that you said, that the Iranian president also said that this particular method of herd immunity is not going to work out in the longer run. Dr. Valerio Alfonso Bruno, political analyst and senior fellow at Center for Analysis of Radical Right, fellow at the Center for the Future of Europe. Thank you very much for joining us at Newswire today. And Mr. Hamid Reza Gholamzadeh, analyst, joining us from Tehran. And with this, we come to the end of the first part of the Newswire. And when we return, we'll be discussing the effects of the a sudden countrywide lockdown in India, particularly on the migrant workers. We'll be back in a bit. Stay tuned. Welcome back to Newswire. I'm Jawad Tehami. As the world grapples with COVID-19 pandemic, a sudden 21-day lockdown announced in India has caused panic and mass exodus of migrant workers. The world has seen chilling images of thousands of ordinary people gathered at railway stations and bus terminals in sheer disregard of social distancing. After the states closed their borders with public transport shut, people started walking on foot to reach their destinations. 17 migrant workers have died while struggling to return to their hometowns owing to exhaustion, fatigue, and road accidents. The countrywide lockdown has rendered many jobless, affected other patients requiring immediate and continuous medical attention, and also unleashed one other aspect, that is police brutality in form of beating and humiliation. Prime Minister Narendra Modi has been criticized for causing misery to thousands by announcing the sudden lockdown without planning and preparation. On Sunday, #Modi made disaster was a top trending topic in India on Twitter. How India, a country with over 1.3 billion population, is coping up with this emergent and continuously worsening situation. To talk more about this, we are joined today in Newswire by Mr. Ravi, Srivastav, analyst, joining us from Mumbai, and Ms. T.K. Rajlakshmi from New Delhi. Thanks for your time, both of you. I'll start the discussion with you, Mr. Srivastav. Before we go into an analysis of what the situation is there in India, please tell us a little bit about what actually is the current situation, particularly of the migrant workers who had to return to their hometowns after the sudden announcement of the lockdown in India.
Mr. Jawad, the present situation is that India is having some 1,251 live cases of COVID-19, out of which 32 people have lost their lives and 102 have already recovered and gone back home. As far as the migrant workers are concerned, the tally has gone up to 22 people have lost their lives in a various incidents. Some were accidents, some were exhausted while traveling back to their native places from Delhi, from Bombay, from several other cities. And now the situation has normalized as far as Delhi is concerned. The government could convince the people to stay back in their places. They are arranging meals for them. They are arranging the roof for them, and the shelter homes have been made. A lot of work is being done on that front. Unfortunately, our Prime Minister has got a dubious distinction of putting into the people into hardships. He has got some good intentions, but ultimately the lack of preparation results into disasters. It happened on 8th November 2016 when demonetization was introduced. Some 140 people lost their lives. Again, they introduced GST on 1st July 2017, and number of businesses completely crashed and the unemployment rate went to as low as that of 45 years old. Present situation also, there was no preparedness. There was a Janta curfew imposed on 22nd of March, and suddenly on 23rd March, this lockdown was announced. I think he has good intention, but again, I think he is supported by some very inefficient, incompetent, and the people who are not knowledgeable about the particular disease.
Okay, Miss Rajlakshmi, I'll come to you. As Mr. Srivastav has just pointed out, this is the lack of understanding among the people sitting at the helm of affairs in India, led by the BJP government. The thing which I want to ask you at the moment is, for India, what is a bigger threat as of today? Is it coronavirus alone, people on the roads, or both are adding up to the misery, and the situation is becoming a twofold challenge?
Which is the other challenge? I didn't hear.
The one challenge, the coronavirus, of course, the whole world is facing this particular challenge. The other one of the migrant issues. So the people have come, they are trying to return to their home countries and towns rather, after losing, many of them have lost their job and many of them have lost their lives on the way. So is it turning out to be a twofold challenge for the authorities there?
Of course. I mean, because this entire situation itself is quite unique to every country, for that matter, and that is why this emphasis on preparedness has been is being made, because when the curfew, when the Janta curfew was announced, 1 day curfew, and then subsequently 2 days later when it was extended to the whole country, clearly the states the state governments did not get too much time to prepare for it or for any kind of a contingency arising from it. And as you know, I mean, just like your country, just like Pakistan and several other developing countries, the nature of the unorganized sector is very high, So, which means that one should have factored all these things into before announcing.
So, to take all these things into account, how much time do you think the authorities should have taken? Rather, they have the justification because the coronavirus was threatening the human life by itself very much. So, how much time do you think the authorities required in order to make such a huge decision?
Really, as to how much time should have been given, but clearly whatever time was given was not adequate, and was really not adequate, which anybody would sort of agree with. So it's not something that I'm saying out of something new. But on the other hand, I think that there are various streams of thought in a country, because we are a democratic country. So there is a point also that the lockdown was important, as the previous speaker also said that it was important. I mean, a lockdown was important clearly because it reduces the spread and the transmission as such. But at the same time, given the economic situation of the people in a country, their situation should not have been created where people would come out on the roads and head towards home because they've been evicted from their homes, or they've lost jobs. So these are the things that any government, any elected government for that matter, here, your country, anywhere else, should ideally sort of factor this. So these are governance issues, these are administrative issues, and ultimately when they come out on the streets, then there are certain administrative excesses that everybody has seen. I mean, it's all over. But as I said, that these things should have been planning, because it's not that it was not known. The fact that Kerala, for instance, the government of Kerala, because the cases were first reported in Kerala really took steps, screening, testing. So all these things were done. So and that now they have contained it. I mean, they've contained it. There are some more cases been reported, but they took.
Ms. Rajlakshmi, I totally agree on this particular point, because the entire world is gripped in this pandemic, and every country is trying to make measures in order to contain the spread of the virus. But when we talk about particularly India, the opposition politician Rahul Gandhi has also criticized the government for taking such an abrupt decision without any proper planning and preparation. As for now, as Mr. Srivastav has already alluded to, that the number of infectious deaths due to this virus are 32. On the other hand, the number of death toll of the migrant workers who are dying on their way returning to their hometowns has risen to 23. So they are going sort of parallel. So what happens to be a bigger threat at this point in time for India at the moment?
Mr. Jawad, I think it's a problem is compounded, and the government of India's reactions were knee-jerk reactions. Till as late as 30th of January, there was only one case in India, and the opposition had clearly warned the government that this epidemic is going to cost heavily on the country. But our Prime Minister, instead of reacting that time or taking preventive measures, went ahead with the Howdy Trump event, where lakhs of people were standing on the road. They were, shaking hands, and they were in a stadium, a confined stadium, and all those things. And the government never gave a priority. And again, on 8th or 10th of March, suddenly the government woke up from the deep slumber, and they started saying the trains will be stopped, the people will not move, the social distancing should be observed, the Janta curfew will be imposed, that all flights will be stopped, and all such reactions. I think you asked a good question to the journalist from Delhi, and you rightly asked that how much time the government should have taken. In my opinion, time of 72 hours would have been good enough had the government taken a step with the state governments in tandem. Talk to them, decided about everything, arrange for the food, arrange for the stay, shelter, all those things. Probably they could have saved those another 23 lives which have been lost, of the migrant laborers for going their home. And there is a big debate going on in the country that the people who paid the money, who were brought from the foreign countries by the flights, the government took care of them. But those who are the poor people, who are the daily wage earners, the government did not care about them.
And Mr. Srivastav, you said that the government didn't take care of all those people who are the daily wagers, who are the laborers in India. Coming to another aspect of this whole saga that is unfolding in India, Ms. Rajlakshmi, we have seen images of police brutality. People are beaten, charged and fired tear gas at. Don't you think this attitude from the law enforcement is adding insult to the injury and already war-stricken people who are returning to their hometowns?
have in a country spoken out against it in very strong terms, and they have essentially said that this is not the way to treat people, and you cannot have two standards of treatment to people in the country. The law can't look at people differently in a democratic country, and so these things have been highlighted, and it's very good that there is a healthy criticism of what's happening also. But as I said, the thing which everybody agrees is that because we are federal system of democracy and governance, where the state governments should have been ideally taken on board. Even today, I do not think that kind of a discussion is happening. So the kind of measures
that are Rajlakshmi, you are of the view that the federal government should have taken the state governments into confidence before announcing a sudden lockdown that is playing havoc with the lives of the ordinary citizens in India. With this, we come to the end of the second part of the show. Mr. Ravi Srivastav, analyst, joining us from Mumbai. Thank you very much for your time being at Newswire today. And Ms. T.K. Rajlakshmi, journalist, joining us from Delhi. With this, we come to the end of the Newswire for today. With more in-depth analysis on some important issues from around the world, we'll be back with you tomorrow. Till then, take good care of yourself. Goodbye.